Welcome to another edition of Office Hours with State Representative John Hampton. I'm delighted you can join us today. America's aging population is exploding. People are living longer, which is the great news. Our biggest concern is, are we ready for America's ever-increasing aging population? The good news here in Connecticut is we have a wonderful organization called the Commission on Aging, run by Julia Evans Starr, who's here with me today to talk about the challenges we face in an increasingly aging society and helping make sure that older folks, older Americans live their lives with quality and with access to the best in healthcare. So I'm so excited that you joined us here today.
Thank you for inviting me. Happy to be here.
Yes, it's great. Now tell us about you, first of all. Where are you from originally, and how did you get to Connecticut?
I'm a Midwestern gal. I went to school in the Midwest. I got here to Connecticut and in this place with the Commission on Aging through the love of my grandfather, Mac. He was a farmer turned fisherman. He had this amazing wit and wisdom, probably the most spectacular person I've ever met. And he was the first person in our family to get a computer. So he was in his late 80s at the time.
Wow.
And he lived to be almost 100 years of age.
Wonderful.
Toward his last 10 or so years of aging, I went and I lived with him. And I saw the unique challenges that he had as somebody living in their home and being 90 plus years of age. And that was a real eye-opening experience. And so I decided I wanted to specialize in working with older adults, try to improve their quality of life. And my first internship was with the Older Women's League. I just found the picture from my file yesterday. It was from 1991. I was in grad school, and I was at the Missouri State Capitol with women that were well into their 80s and 90s.
And it was called what? The
Older Women's League.
Okay.
Yeah. And so eventually I came to Connecticut. I met a gentleman in grad school, and he was from here. This is how I landed here.
And the Connecticut Commission on Aging. What is it? How long has it been around? And how long have you been with the organization?
Believe it or not, it's been around 20 years.
Okay.
I've been with the organization for 19 years. And we're a nonpartisan public policy office off the Connecticut General Assembly.
So you're not to be confused with the Department of Aging. I know at one point Connecticut had a Department of Aging, and now we didn't for a while, now we do.
That's right.
How do you differ from the Department of Aging?
Well, I know you know, but there is some confusion
Yes.
out there. So it's like apples and oranges, really. The Department on Aging is an executive branch office.
It's like a cabinet level.
Right. And they're like DSS, the Department of Public Health, and they administer programs and services. And they have about 30 employees now, with Commissioner Prague at the helm.
Yep.
And their biggest programs that they administer are the Elderly Nutrition Program and the Long-Term Care Ombudsman Program.
Okay.
And the commissioner reports to the governor, and they carry out the governor's agenda. We're a public policy office off the legislative branch. There's 3 of us. We have citizen volunteers across the state, actually one of our finest members.
Yes.
As you know.
Bill Eddy.
Yes.
Absolutely.
He's done amazing work. He's helped us identify legislation, best practices, and actually worked with the legislature to get some bills passed that were very important in helping people stay in their homes as they age.
How have you seen things evolve in your almost 2 decades at the commission? I mean, aging issues seem, as I said earlier, to have really exploded, and that must be in due part to the boomers.
You're absolutely right.
Yeah.
So when you said the population is aging, it's growing by leaps and bounds. We're already the 7th oldest state in the nation.
Yeah, tell me some of the statistics.
So we're the 7th oldest state in the nation. We took a picture in time, and we looked at 2006 to 2030. And we noted that from that period, our 65-plus population is going to increase by 64%.
Incredible.
It is incredible. And you mentioned baby boomers, people born between 1946 and 1964. Those folks are 1 million strong in Connecticut. That's almost a third of our population. So that's one of the reasons why these issues are becoming even more critical, is if you do the math, you know that the leading edge of the baby boomers are turning 65 and beyond.
Are we ready for the explosion?
Well, what I can tell you is we're working on it. And there's a lot of work to be done. And I don't think we're quite ready for it. I think there's a tremendous amount of work. We led the charge, we at the Commission on Aging, we identified in 2006, we worked with the legislature to conduct a long-term care needs assessment. What's that about? We know people want to age in their homes and communities. It's a fact.
Aging in place.
Yeah. And we did a survey, we did an analysis, we worked with the Yukon Health Center, and we found some interesting things. And from that, there's been a series of policies that have passed and programs. And one of those is money follows the person.
Now, what is that for folks at home? What does that mean?
So what that means is the state Department of Social Services, an executive branch agency, is administering a program where they get enhanced funds out of the federal government to help create a culture change, really. Right now, we're what we call institutionally biased, or we have been historically.
Nursing homes?
Yeah, once somebody has a specific level of care needs, we would think in terms of people going into a nursing home. And we've been working over the course of the last several years to change that dynamic, to help people stay in their homes and communities.
Yeah, more people are doing that. My parents live in their homes with full-time care, and it's a great quality of life. And the numbers show that it saves money.
It saves a lot of money.
And improves people's health.
Right.
You don't want to always be away from your home or an institution, and so it's a great effort.
Yeah.
It's a win-win.
It is. And so we have a program now where folks are not only not going into nursing homes, but people are moving from nursing homes back into the community. And we work in an advisory capacity for that program, co-chair of the steering committee. And over 1,000 people have transitioned from nursing homes back into the community, which is unprecedented.
It is amazing.
And when nursing homes close, which has been the case in Connecticut in recent years, instead of finding another nursing home, they talk to the person, they talk to the families and say, would you like to go back to your home and in your community? And they're finding, yes, people do. And so it's an amazing effort that's underway. Consistent with that is we're going to see more nursing home closures, even though we have this population that's aging, and it's growing by leaps and bounds. They're going to be taking some beds offline, some 9,000 beds offline in the coming years. So when you ask, are we ready, there's a lot of work to be done in this area.
I think culturally, too, I'm not sure as a nation we're as accepting as our older a population as maybe other countries. I don't know if you see that or that's an opinion of yours, but
could you talk a little bit more about that, what you're thinking?
Well, you hear in other cultures, maybe in Japanese culture, where there's more respect and their elders are living, more elders in other countries are living with their families, and that's just sort of a natural thing to have your grandma and grandpa under the same roof.
Right. Yeah, I think historically, at least from my view, you've asked what's changed in the last 20 years. I think one of the biggest challenges is ageism. That
absolutely
people don't want to face aging issues.
Who does?
Right.
It's tough, and we're geared toward being a young nation. Everything is young and sexy, and
that's right.
And how to get rid of the wrinkles and everything, and it's not always glamorous.
No, but I think the baby boomers are going to redefine aging. I think we're in the midst of that.
Yeah.
You know, when you think about the aging population, we talk about it. AARP says you're aging at 50. And yet, you know, we celebrated this month, it's Older Americans Month, Unleashed the Power of Age, trying to take on a very positive aging approach. Centenarians, people over the age of 100 in Connecticut, people who are centenarians, we have 900 individuals.
Yeah.
So when you think of the age span of folks we're talking about, they're going to have completely different issues. And that's why at the Commission on Aging, we try to look across the lifespan and help identify best practices and policies that help people as they age, starting very young.
Yeah, it's people don't realize that so many of our older Americans are vibrant and still want to be vibrant, and volunteer and be integral members of our community, and they're so valuable. And but I think sometimes there is a tendency to overlook that. I know in my municipal experience, it was always easier to get funding for maybe new lights for the football field, which is all well and good. But when it came time to look at maybe money for tax relief for a senior center, there's less appeal there. So sometimes I think that the pendulum doesn't swing far enough to our seniors, and they get sort of shorted on that. And Lord willing, we'll all be seniors.
That's
and,
right.
It's the great equalizer, and we want to have our own quality of life, and we want our parents to have the best quality of life. So thankfully, there's an organization like yours, and I know you run on a shoestring budget.
We do.
And you do a lot, and here we are in the legislative session of 2013, and talk about some of your successes so far. You've had a few.
We have. First, I just want to say, on days like today, where it's so beautiful outside, and I actually feel so fortunate to be able to work in this building.
Sure.
Our office is on the 5th floor of the state capitol. We get to meet with and work with really interesting people such as yourself.
Absolutely.
People who
Great
are
mix of folks,
Yeah,
diversity.
people who are enthusiastic and want what's best for the public.
Yeah.
And it's, 19 years later, I feel quite fortunate to be able to do this.
Yeah, you're only 25, which is
Well,
great.
I know.
You've
Well,
really.
I started very young.
Has the acceptance of your organization, has that changed? I mean, did you feel like in the early days it was like, I think you've brought it to a new level of visibility, and is that
hope
took a
so.
while, huh?
Yeah, I think it does. It's always the challenge, the work you do to promote yourselves versus your important work that you do on a daily basis. And when there's 3 people, how much time do you really take on promoting the organization? I do think the two go hand in hand, but I think you build credibility when you work with policymakers and they get the quality of your product, and I hope that's what you've experienced.
Absolutely, and as a member of the Aging Committee, I know we've heard a lot from you and benefited from your experience and your perspective. And I know this year a big initiative is livable communities. And for folks watching, I was wondering if you could talk more about livable communities.
Yeah. So ones, they kind of use them interchangeably, the aging in place and livable communities. So aging in place is obviously an individual's ability to be able to stay in their home or their community of choice as they age. The livable community initiative or term is how ready are your communities from a physical, health, structural perspective to be ready for this aging population and to help make that a reality, that you can age in place.
Yeah, it's interesting you bring that up. One thing we're talking about in Simsbury now is a new senior center, and some people are thinking about putting it, a mile or so out of the center. And I'm thinking, well, in terms of a livable community, I think you want seniors central to your community. First of all, because they're integral to the community, and then second, they can walk from the senior
Right.
center to the shops,
Right,
to
it benefits your
grocery
community,
store.
your
It's
businesses.
it's a hub, as opposed to putting them somewhere else,
Right.
out of sight, out of mind. So I think that's probably what you're talking about, is make the seniors, their lives more livable and connected
Right.
to everybody else.
Yeah, you're absolutely right. 15, 20 years ago, assisted livings were built, in Connecticut, across the country, in places that were probably the cheapest,
Yeah.
where land was available. And what we found is assisted living model was supposed to really help people remain active and engaged, but you've taken them away from the community.
Yeah.
So now you need to provide transportation and a whole range of issues, and really you've just isolated a lot of people. So I don't mean to pick on assisted living, but all
No.
different kinds of structures or a senior center. You
Sure.
really absolutely want it to be near the hub of the community.
Well, and there's also the debate in town whether the senior center should be just a senior center. And I can understand that, but then you think, well, somebody else said, well, how about have the teen center and the senior center and the community center together? so everybody's exposed to each other in the different generations. And but I know it's a constant struggle for seniors in our community and everywhere else to feel that they are part of the community. And so many of our seniors are alone, and they need the support. I know our senior center in Simsbury is key. We have so many different programs that help seniors, and we need to make sure, as we've talked about, that we have a great society, but it needs to be great for them as well.
Right.
And
I do like the intergenerational approach.
Absolutely.
I mean, it's obviously not my call for your community because it varies from
Yeah,
community
sure.
to community. And if you ask senior center directors across the state or even across the country, they'd be very divided in
Oh,
if it
sure.
should be a community center or senior center. So there's no right or wrong answer, but that debate is going on in every town practically. And I think there are very successful models for both.
now, out of college, my first job was with the Alzheimer's Association.
Ah.
So that cause has been near and dear to my heart, and I've, right around the time I worked there was the diagnosis by Ronald Reagan with Alzheimer's disease, and we saw the visibility change, and now, all these years later, obviously, the disease is rampant, and
Right.
we have a better appreciation for it. And there's some progress being made in this session. Talk to me about your perspective.
Yeah, so there's House Bill 5979,
Yep.
I believe, and it establishes a task force to develop a plan.
Yep,
And it
I
fo-
started that bill.
Well, then why am I telling you? I knew
Exactly.
you testified for
Yes.
it, but I didn't know you started
I was the
it.
initial sponsor and happy to do it. Worked with Lori Julian of the Alzheimer's Association, and does create a state plan. It's a task force, and will help the state work with family members and professionals, and how Connecticut prepares, again, for older people and
Right.
folks with dementia and their families.
And I think it's important discussion because as we talk about livable communities, are we really talking about folks with Alzheimer's and related dementia? Is that part of the discussion? And so a lot of these issues and bills are really quite interrelated, and to have a bill that would do just that, I think is really important. And people say, oh, do we need another task force? Well, the Aging in Place bill is the embodiment of a report that was done by an Aging in Place
Sure.
task force the year before.
Yep.
And so you have stakeholder buy-in, you have a very vetted process where you came up with meaningful recommendations. So I do think it's incredibly worthwhile, and thank you for that, Bill.
No, and I thank the Alzheimer's Association and your group and all the folks that have worked on that and other issues. Are there other bills that you are shepherding through the process?
Yeah, there are bills and there are budget issues.
Sure.
That we're watching, and we're going to see how those play out in the coming weeks. I mean, the session's almost
It's
over.
just weeks, and
Is
we're
it gonna
dealing
end
with
on
this,
time?
I'm hoping so,
Yeah.
hoping so. We have this little thing called the budget, and what is your biggest concern in that budget from your perspective?
Our biggest concern, I think, a lot of the work that we do is to bring transparency and accountability to state government. So we keep a legislative tracking tool, which has the
Yeah,
budgets
it's so
on it.
important, yeah.
Thank you.
I get
It's
that.
now like 36 pages.
Yeah,
and
it's great.
we share it with legislators and stakeholders to keep everybody abreast of what's happening this session. And a lot of people want that document. It's in hot demand. I think one of the challenges this year, from a budget perspective, was it was kind of hard to determine what was actually in the budget. And so we've been doing some investigative work over the course of the last few months to really
It's a
determine.
little light reading, yeah.
Right,
Yeah,
right.
Yeah.
And so that's been an issue that we've been following. And we know some good things that are in the budget but aren't really pronounced, or because you don't see them anywhere really, are the rebalancing initiatives. Again, going back to keeping people in their homes and communities. There's small pools for caregiver support, which is really important. We work a lot on long-term care workforce issues, because we have something we always promote. It's called the alligator chart. And we know the population, the older adult population, is increasing like this, right, by leaps and bounds. And then you have your younger population, which is actually decreasing. So we're thinking, okay, as far as a readiness, who's going to be there to help folks in the time that they're gonna need some services and supports. And so there's a lot of work being done there, but truly the backbone of, helping people with services and supports are caregivers, these unsung heroes.
Sure.
And how do we help sustain and support caregivers? And as a policy.
Absolutely.
And we've just started to really explore that in a meaningful way.
I always like to see what other states are doing on different policies. Are there other states that are really good models in terms of aging issues that you see?
Yeah, I have to say, with the Money Follows the Person rebalancing, we are at the very top.
Great.
Yeah, and we look at the issues across the lifespan for older adults and persons with disabilities. There's no direct age connected to it. So we've made a lot of success there. As far as caregiver support, there are different models out there that might, in other states, pay a caregiver or give them a stipend, and we do a little bit of that in Connecticut, but there are concerns about how much that might cost, and now's maybe not the time to do that. There was a bill this session as far as the Aging in Place Task Force, and there was also a standalone bill that would give income tax credit for folks who were caregivers, and because of the large fiscal note attached to that. So it was an incentive,
Sure.
but it was too costly, really, but it's good policy.
Yeah.
And other states do that, so.
Yeah, your head must spin with all the things that you try and, mine does, certainly in the legislative session. It's a short time period, and obviously we dealt with the Sandy Hook legislation this year,
Yeah.
and a lot of other things are on the docket, so you must get overwhelmed and try and
Right, and as you know, things don't take a straight path.
no, they don't. I've learned that from the transition from municipal government to state government. It's a little different, a different experience. One of the bills I'm working on, it actually died in committee, but it's a bill that during all the major storms that we had recently, we had a nursing home that was willing to take elderly and vulnerable who needed extra attention, but because of the regs and sort of bureaucratic red tape, that could not happen. So I've put a bill forward that would make it easier for a nursing home to become a temporary shelter for folks. Because when we had 7,000 people in our shelter, we had folks coming in with dementia, folks coming in with oxygen that we were not necessarily equipped. So we have a great nursing home locally, McLean Home.
Yes,
And
they are wonderful.
they are voluntarily wanting to do this, so my bill would hopefully do that. But of course, as you know, some bills die, and that bill died, but hopefully through an amendment process that could get through. So as you know, things sometimes take a circuitous
Right,
path, and it's not
right.
always as government is not always quick.
No, but I guess you really wouldn't want it to be, right?
No,
when you're
it's too
making
important.
significant
It's too
change, right?
important.
You want it to have a vetting
Yeah.
process.
And,
So sometimes it's frustrating, but other times you really appreciate it.
Absolutely. And having groups like the Commission on Aging at your disposal as a legislator is so invaluable. So I really want to thank you for all the work that you do. And how many folks are actually on the commission? Like Bill Eddy is on the
Yeah.
commission. There's
I want to answer that, but I don't want to miss the chance of talking about two bills.
Sure.
One was the community spouse bill. It's the an amount of assets an individual can keep if their loved one's in a nursing home on Medicaid. So
Oh.
that helps sustain somebody in the community if they have adequate assets to be able to remain there. That's
where's
one
that bill? Do you know where that is in the cycle?
That's one that keeps changing iterations, but I can tell you about that when we
Okay.
get off.
Yeah.
Deb McNaughton, our office,
Okay,
is tracking
great.
that one down. Yeah, I don't want to give you the wrong information.
Okay.
The second bill is a fear of retaliation bill that the Aging Committee brought
Yes,
out
yeah.
on behalf of the Long-Term Care Ombudsman.
Tell folks what that bill.
Yeah, so we have residents in nursing homes across the state.
Yep.
And there is an ombudsman that when people have quality of life issues in a nursing home, they would contact their office to help them mediate some of the problems.
No, great.
Yeah, that they experience, and that's the role of the ombudsman. What they found is a lot of the residents are afraid, whether it's perceived fear or actual real fear,
Sure.
to ask for help. Hit that call button. Say you need to go to the ladies' room. Whatever it is, they're hesitant because they feel like care, it might backfire on them.
Oh,
that
that's
care
terrible.
might get withheld. And so the residents, this is the beauty of this bill really, is the residents across the state have councils And they came together and they identified this as one of their top 2 priorities, to have a fear of retaliation bill. All that would do is nursing homes train their employees, their staff. Part of their training would be about retaliation and how it feels to be a resident, and what are things that you can do differently to work through those
That's
issues.
wonderful.
It's a great bill.
It is a great bill. So important too, because I
Yeah.
think, well, I know older folks tend to feel more vulnerable, and this is an added protection and safety for them.
Right.
And so,
And if the voices of the residents are telling you that this is what they need,
yeah,
it's quite powerful, really.
yeah, that's
You should
great.
listen to their voices.
You have a website, right? So folks can go to it.
We do.
We're gonna flash it on the screen.
Oh, good.
So
We have a number.
what's
Bob
it?
in our office, Rob, Bob, whatever you want to call him.
Mr. Norton, great guy, and Deb
he is a
Bignol.
great,
Yeah.
he's going to answer the phone every time. People are shocked that
Yeah. What's the phone number?
It's 860-240-5200.
We'll flash that on the screen as well, and the website. Can
Is-
you remember it? I can't always
hope so.
remember mine.
Okay, www.cga.ct.gov/COA.
Excellent.
So that one's
And
pretty
that'll
easy.
be on the screen. So members of the public can call you.
They do.
And-
They call us. There are a maze of services out
Yeah.
there, and people really don't know where to go. If you want information about a program or service, you might want to call your local senior center.
Or your state rep.
Or your state rep, or
Of course.
211. We do
Yeah.
a lot of troubleshooting.
Sure.
People who just don't have that typical question to ask.
Yeah.
Rob was on the phone with somebody a good hour this morning.
Yeah, he's great.
Yeah, working through a housing issue. We're just there, we're there to help, even though we're public policy and research, we know all these stakeholders and our partners, and we can probably get you in the right direction.
That's terrific. And how many folks on the commission?
So there's 3 staff, and there is 21 citizen
members,
board members.
commission.
They're unpaid, they're volunteer, they give us their time, their
Sure.
expertise. They're really quite remarkable. We have the chief of geriatrics at Yale, and
Wow,
Haven.
some great minds.
Yeah, we have retired business folks, people who want to give back.
Yep.
You talk about, the wisdom and the expertise that older adults have, and sometimes that's overlooked. Not at the commission. We harness all that they have to offer, and we're much stronger because of their input. And they tell us what's happening in the community, so we're not so out of touch. We're on the 5th floor of the state capitol. We need to be out and talking to people like you. You can tell us what's happening in your
Absolutely.
community, and having broad partners, so.
And the state is much stronger because of the Commission on Aging.
I think so.
And all the great work that Julia Evans Starr does. She's our own star in the aging world. And we are lucky to have you, and I really appreciate you. All that work you do in the Commission on Aging, and count on my support.
I really appreciate
And
that.
hopefully the residents at home have learned more about your organization and the great work that you do. And I'm so glad that you joined me today in office hours with State Representative John Hampton. I hope you'll come back.
I hope you'll have me.
And please keep in touch, and we'll see you another time. Be well. Take care.
Thank you.
Thank you very much.